The predominant strain that's circulating right now is a variant off of Omicron that we started seeing in December, January of last year called BA.5. It presents very similar to how we've seen COVID present throughout the pandemic, typically fever, cold symptoms, and in a smaller subset of people, more significant breathing problems, respiratory symptoms, and more severe illness. The people most at risk, again, are fairly similar to what we've seen with variants in the past. It's the individuals who have not been vaccinated or with risk factors for more severe disease. So the elderly people that are above the age of 65, 70, and especially if they haven't gotten their boosters or vaccines at all, are at increased risk. Other risk factors tend to be the same: obesity, weakened immune system because of medical problems. All those are still risk factors for more severe illness. As we kind of mentioned yesterday, while hospitalizations are increasing, we haven't yet seen an increase with this variant settling into our communities hugely as far as number of patients in the ICU on ventilators, but need to monitor that number very quickly. It takes several weeks for people to develop more severe disease. So, I think the next couple of weeks will be telling on what we see with this relatively new variant to our area. So the characteristics of BA.5 are, again, as we've seen with Omicron, it is highly transmissible, highly easily spread. BA.5 also is thought to have more what we call immune escapes. So people who had infection previously more prone to repeat infections, and some increased escape from people protected by vaccines. Again, boosters do help kind of minimize that risk. So would strongly encourage everyone to be up to date on their boosters if they aren't already. Pretty much every adult certainly should have at least one booster, and then those over 50 are eligible for 2 boosters. So, again, that's one of the best things we can do to protect our community and remains very important. As far as severity of illness, when you see numbers go up, we tend to see hospitalizations go up. That doesn't mean at an individual level that disease is more severe, but I expect as we're seeing cases increase in the community over the next couple of weeks, we will continue to see increases in hospitalization, and a small subset of that will have even more severe disease, end up in the ICU or on a ventilator.